This is a question I've been dying to ask you. What do you think? Why do you think we're seeing such a rise in people with knee OA? It seems like almost epidemic now. You know, you get people actually really seriously considering knee replacements at 40 and 50. What do you think's behind all that?
Well, I think that the biggest thing is just the sheer number of people, right? We're into the baby boomers, and so therefore the numbers, we got more people.
So yeah, I'm going to turn your volume up just a little bit.
Okay.
Yeah, that's a little better. Okay. You just feel like it's sheer volumes.
I think that's a lot of it. I also think that we are probably the most unhealthiest that we've been in a long time as far as what we eat, and I think that plays a huge part into arthritis, these very chronic diseases.
Mm-hmm. Okay, so yeah, I agree with you with the diet. I mean, I know that there's more just because the baby boomers are getting up there, but that doesn't explain those really young ones. You know what I mean? And a lot of times they're actually sicker. Okay, so what type of person with knee osteoarthritis is a good candidate for stem cell treatment, and why? I mean, there's kind of some different phenotypes of OA, like a early injury, or somebody with bilateral knee pain that it's more metabolic, or maybe alignment issues. Which of those types would be a better fit for stem cell treatment?
Well, definitely the folks that have less of their alignment is good, their stability is good, their disease is mild to moderate, and it's something that is potentially a truly a wear and tear. Those guys are definitely potentially going to do better, but everybody's you have the range from someone that's a good candidate to a poor candidate, or to a failure candidate to a poor candidate. It just kind of depends, right? If they they change some of those things, if they work on what they eat, if they work on alignment as far as through therapy and the stability through therapy, and then those things they can boost themselves up in that
better category.
In a better category.
So do you, as you see people come in the office, do you work with them that way and counsel them and say, hey, we'd like you to do X first before you come back? Or is it stem cell plus these things at the same time? How do you work that?
Yeah, so it can be either or, right? Definitely do these things and then back and do this, or let's do them concurrently to get to that we know. Regardless, stem cell is one avenue, and the whole picture is the whole picture, right? Which is usually what we don't look at. But if you're going to do those things and you don't look at their nutrition, then you're doing them a disservice, right? And so those things are really they need to happen all at the same time. And sometimes when you do that nutritional piece, man, they don't need you, which is great, right? We've had that have done these things, and it's like, hey, I'm feeling pretty good. So
yeah, that's awesome. That's awesome. Okay, so are all stem cell procedures the same? And what are the top 5 things to look for in a stem cell?
Definitely things. All stem cells are not the same. As far as what we have now, there's two big categories of stem cells, and the first that we'll talk about is from bone marrow. That's been categorized and probably studied the longest, especially when it comes to musculoskeletal things. We know we got stem cells. We know what they look like, what they do from bone marrow, and they can two types of stem cells in bone marrow. There's mesenchymal as well as hematopoietic. And so that automatically kind of gives you a leg up because you got two in there versus something that comes from adipose or fat. That would second place. There's definitely mesenchymal stem cells in there. Definitely can help in things. And so those are going to be the main two types of stem cells. There's a lot of question about, well, what about the amniotic tissues and those things? And the issue with that, and I try to be very objective about looking at all the tissues and how they can help, what you can do with them, how they work. And the things about the amniotic tissues is like, there's a question: is there stem cells in there? And if there's a question in the literature about them, usually there's a question, right?
Right. Right.
And so, what I counsel people on and educate people on, what I tell folks is that there's definitely growth factors in those tissues. Tissues definitely can help. They can make you feel better. But is there stem cells? I don't think so. There may be not alive cells. They may be dead. And so,
Mm-hmm.
and of course, the FDA makes it very clear, if someone other than a doctor says that there's stem cells in that, then that's against the rules. That's a party foul. Um,
Oh, okay.
you know, a physician can, or doctor can say those things, but once again, as the FDA has kind of stepped in there and said that about it too, then once again, there's still a question. Once again, I think they're good products. I think they can help. You still have to vet those, right?
Mm-hmm.
Because not every dose that you get, or every person that's making one of those products has done a very good job of it. And so there's, there's
So who's pushing those the most? I mean, that are non-doctor related, like, do you mean like chiropractors maybe, or who is it that's pushing more amniotic?
well, amniotic tissue is something that runs across the gamut. It's not one particular
Okay.
group. It is just something that's out there that can be used. It's easy to use off the shelf. There's no processing. There's no getting tissue and no procedure other than putting it back into the place. And so it makes it, it's readily available to some degree, and it just makes it easier.
Mm-hmm.
And like I said, I think that that they are great tissues, but just to call them stem cells, I think is where we kind of run into the issue.
Mm-hmm. So if somebody's, shopping around, how do they decide which is the best clinic and where should they get it done? I mean, a lot of people ask me questions, and they want to know, obviously it's not cheap, and they want to get the best effect for their knee. But what should they be looking for?
So the things I think that you should be looking for, someone that's knowledgeable about all the things, whether
All the
it's
ins and outs.
whether it's amniotic tissue, whether it's stem cells from bone marrow, whether it's stem cells from adipose or fat, and someone that can speak to all those things, that can truly educate you on this process. Two other, the next thing to look for is someone that is going to, when they come to, that they're a musculoskeletal expert, right? So they know hips and knees and joints,
Right.
and nerves and all that, like intimately. And like when I say, like, like what the MCL does, what the LCL does, the lateral collateral, the medial collateral, what the meniscus is responsible, what it's not responsible for, how that disease process will present in someone, right? Because just because someone has an MRI or X-ray that shows whatever doesn't mean that that's what's causing the problem. And so,
Right. That's really important to know.
very important. And so it's really hard to vet someone like that, right?
Mm-hmm.
A patient's not gonna be not gonna readily see that or know
Oh
that,
yeah.
like you, right, when talking to someone.
Mm-hmm.
But someone that that second one, someone that's musculoskeletally trained, like well trained. Another simple thing is, like, well, how do they put it in? Do they just inject it in your knee, or do they use some sort of imaging, right?
Mm-hmm.
And looks like they know what they're doing with that imaging. My background as an orthopedic surgeon. I operate on joints. I operate on
Yeah.
tendons. I inject. I've been doing it for a long time. And there was a time in my life where I would inject a shoulder or knee blindly. And it's like, oh, this is how I learned to do it. We would palpate and say, okay. There was a study done probably now about 10 years ago looking at orthopedic surgeons who would inject shoulders. And these aren't residents; these are attending physicians.
Right. Right.
And what they found is that only 40% of the time were they in the right place in the shoulder.
Yeah.
40%. And so you don't know if that injection that you gave didn't help because it just didn't help, or probably didn't help because it wasn't in the right
Didn't
place.
get there, right?
Yeah. And so
Yeah.
and then when you're talking about something like stem cells or PRP or amniotic tissue growth factors, that costs a lot of money and you're doing it blindly, man, that's just
Yeah.
that's a bad deal.
Hmm.
Um, and so if they're not using some sort of imaging, then you ought to run away. Like you just don't want to waste your time with spending a lot of money for someone
Yeah,
that's
that's a fantastic question for people to ask. Again, call up the clinic and say, does your doctor use imaging or not? And well, that would rule them out right away. And what would they, to go back to the type, do they really want one or the other? Do they want bone marrow? Do they want, if you're calling up a clinic again, I don't know anything. I'm just I've got pain in my knee,
yeah.
and how do I do that?
Like I said, I think that the bone marrow stem cells definitely have the leg up because there's two types.
Okay, so you would advise that first.
It's the one that's been most studied.
Okay.
It's been around for a long time.
Evidence based.
Yeah, but I'm not saying that that adipose doesn't have its place, right? So you know,
Do they both cost the same, Dr. Kellum? Different
well,
levels of pricing.
they usually if I said if one that costs more, it's going to be bone marrow more than likely. There's a little bit more into processing that. There's a little more into harvesting that versus getting adipose. And so bone marrow is probably going to cost more. But once again, bone marrow has been studied the
Right.
most.
Mm-hmm.
And has the most goodies, so to speak, in it.
Yeah. Now, do you find are insurances paying for this now, or is this still mostly self-pay?
Yeah, they are not. It's mostly self-pay.
Okay. And what do they run a knee?
It can be anywhere from, depending if you're talking stem cells, anywhere from 1,000 to 10,000. If you're talking about PRP, anywhere from 500 to 1,500. It just depends on
In the country, or the where we are in the country, like which state you're in?
who's doing it.
Okay.
Price
Okay.
average for stem cells are going to be around that 4,000 mark. And PRP.
Now, after you inject a patient, you see him for a follow-up. Are you actually seeing changes in the imaging, or are you just looking for patient-reported outcomes?
So it's mostly going to be patient-reported outcomes, right? Imaging is very interesting because of that comment that we made earlier about, like,
Mm-hmm.
hey, sometimes you can have an ugly-looking MRI, you don't have any pain.
Exactly.
And so that's the thing that's really, that's fascinating to me. I've had a patient where I've injected her knee. She had some meniscal pathology, some degenerative tearing. I've injected that and got a repeated MRI. MRI looks great, as in that degenerative tearing stuff went away, but she didn't feel any better.
Oh yeah. Huh.
What happens most of the time is that you inject them, MRI looks the same,
And they better.
feel better.
Okay.
After, and that's really the way that these things work. Most people will tell you, and this is another thing, if someone tells you that we're going to heal this tissue, especially if you're dealing with arthritis, I'd definitely run away.
Mm-hmm.
Stem cells and PRP, there are some tissues that they can heal. Like if you've got a partial tear in a rotator cuff, or you got a tennis elbow where the ligament or tendon is close together and it can heal. It can actually heal those things. But when you're dealing with arthritis, it's not going to make new cartilage where cartilage is gone. Someone would win the Nobel Peace Prize for that.
Mm-hmm.
But what it is going to do is that there's bad factors that live in the knee, and that once again has been borne out in the literature, and we also see it in everyday practice. Someone's got a knee MRI or X-ray that looks pretty bad, but does it hurt? Someone that has a one that's not so bad and does. And so it has to do with what's inside the knee, right? So there's bad factors, and we know the names of them: the metalloproteases, the TIMPs, the IL-1s. All these things cause pain. And what stem cells and PRP, how they really work, is that they go in there, they decrease those bad factors. When those things are going away, the patient's pain is better, and that's what we're after.
Okay, so now what are you seeing in terms of time lapse? So you put it in somebody's knee, and you do follow up a year later, and then what are you seeing? Are they lasting? How long would be the typical time period?
Yeah, so if you look at someone that you did PRP in, and once again, you have to think of how many PRPs did you do, right? Did you do? If you did one versus three, someone that had three is probably going to be better than someone that had one. but that's going to last you about a year if you did just your. We're talking about a joint, right? We're talking about maybe a knee joint because all the joints are a little bit different of how they
Yeah.
respond.
Okay.
So we're talking. So we're going to talk about a knee joint. Maybe they get a year with PRP, whereas with stem cells they're going to get 3 to 4. That number is slowly creeping up because we're now having people who are like, "Gosh, I had that one time and I'm out 8 years or I'm out 9 years." The only reason we know that is because we've been studying it for that long. That number will probably creep up as we go. Another thing to realize that it's not a cure, right?
Mm-hmm.
And if someone says, "Hey, we're going to cure this and it's going to last forever," and da 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 da, just not true. And those people, I'd run away from too. We want to be realistic with what we do and what we communicate to patients, right? It's very important to love on them and help them live a better life, hopefully without surgery, right? I'm a surgeon. I still operate, but I think that if we can keep people out of the operating room, it's way better.
Yeah. So you do general, or you focus on one?
So I'm a sports guy,
You
and
do
so
everything.
yeah. Well, so as a sports guy, I do a lot of arthroscopy. I do mostly. I'm going to do shoulder arthroscopy, knee arthroscopy, ankle arthroscopies. Other kind of outpatient
Yeah.
sports cases. But we are kind of somewhat generalist
Yeah. Yeah.
so all those skills I kind of bring to the table when looking at general care.
Yeah. And what's the best fit for them? Okay. So, and we touched on this a little bit, but is there anything that can improve the success of stem cell transplantation?
Yeah, I think I think fasting is huge.
Oh, cool.
There's some great research that shows that the production of stem cells is increased if you fast 1 to 2 weeks before. Not fasting for 2 weeks, but the week before or 2 weeks before. Fasting for.
Yeah, that's interesting. So as a prelim, so you tell your patients, hey, if you want to fast a couple days before the surgery, or the injection rather, that'll help.
Yeah, before we harvest
Right, because you're gonna do it all at once. You're gonna pull the bone marrow, right, and then inject it that day.
it's going to help increase your numbers.
Okay.
And once again, that nutrition stuff cannot be understated. It is, man, it is number one. If people can get on an anti-inflammatory diet, if they can, it's going to help them be better. Taking collagen, turmeric, resveratrol. The guys that I take care of, the pro athletes, what I found in those guys is they do better because most of them, they eat extremely well.
Yeah.
And so if we can equate that to, folks like you and I, you're a pro athlete, but definitely me, someone like me, then we'll do better if we have procedures like that. It's gonna have a bigger bang.
Mm-hmm. So do you do any consulting with them in terms of diet and lifestyle? Do you throw them in a different room and put a nurse prac in there and say, hey, help them, come out and figure out what they should be doing, or just give them like maybe general literature?
Yeah, that's definitely one way to do it, and probably the best way. I counsel them myself.
Okay.
As I talk to them about their knee or their shoulder.
You want to put down the Doritos?
I put, like, hey, we have to, decrease the big seven, which are, sugars, gluten, dairy, corn, soy, those things I counsel them about, because that'll change your life.
Right.
In like in a heartbeat.
Yeah.
And your heartbeats too.
Yeah, exactly. And change the cardiovascular status. Mm-hmm. Okay. Let's see. So, yeah, I think I kind of answered that question. And we talked about the cost. Do you guys? You're in Nashville, right?
Nashville, Tennessee. Yeah.
Yeah. Okay. Do you treat out of state clients?
Yep. All the time.
Okay, so people can reach out to you specifically,
and
because when I put it up, my video up, I'll put a link up to you guys' clinic, and they can reach out to you, because they're really having a good one in the area isn't necessarily, for smaller locations, it's not always available for people.
Correct. Yeah. I mean, this is one of the things. It's in this manner, it's been around only for 15 years, right? So it's still hadn't been around for a long time, and when we first we've been in this location for 2 years now. When we first got here, the far majority of our patients were from out of state, kind of here in Tennessee, the 8 contiguous states. Those were the people that came to see us. And so we enjoy having those folks in, and we have, we know how to get them squared away and get them
Yeah, so you take care of them. They come in, and they. How long do they have to stay? Do you observe them for?
We like to to see them 3 times over about a week's time frame, and
Uh-huh.
so we got some places that they can stay and all those good things. So we made to
Mhm. So what are the big no-nos for them to do to know, post injection, what should they limit
yeah.
while they're waiting for that to, you know what I mean? They don't want to probably, go ahead and you can answer.
Yeah, so the thing is, we wanted to kind of take it easy for a little while, have them do some theory, working in some range of motion, things like that, and we just wanted to really listen to their body. If anything hurts them more than like a 2 out of 10, we want to say, hey, we want to back away from that, or not do that, or give more time in between that. But and also just to be patient, because it's not something that happens overnight.
Mm-hmm. Okay. Well, that's awesome. I mean, those are the questions I had. And if there's anything that I didn't think about that you would like to add in terms of helping somebody, with chronic knee pain, figure out whether stem cells right for them, how to choose the clinic, and then the other things that they should be adding, and adding and avoiding, to make it the best success, to get that effect for 9 years out there that you were talking about.
Yeah, no, I think the biggest thing is to really really research the person who's going to be doing your injection, how they're going to be doing that. Obviously know the cost, what they're going to be using. Can they speak to you about those things? People that always that will automatically just kind of poo-poo on something else. Like you have fat guys that go, oh, bone marrow, it's painful when you do that. And by the way, when you harvest that, it's not painful. It's about a 1 or 2 on the scale. And then you have bone marrow guys that said, you're going to have all this pain, and you're going to have all this swelling and all this stuff. And, that's not true either.
Uh,
And so, saying, well, this is the only thing to do. And if they mention to you that, well, this amniotic tissue has stem cells, those are the folks that I would stay away from, because, those things just aren't true. And so either they don't know their field well,
mm-hmm.
or lying to you, and both of those situations are bad.
Mm. I think what you said too, and I mean, you've been in it for 15 years, and I think that would be something that I would look for. You know what I mean? Because this is really new technology. I'd like to find somebody who is in it, more or less from the beginning, that has followed the literature and that knows the issues, rather than somebody just got into it and hasn't seen patients over time. And I mean, that I would be looking for something like that.
Yeah.
Yeah, so I think that would be another thing, a positive thing.
Yeah, and then someone that really that's going to add that nutritional piece to it, right? Because
Yeah,
that's
absolutely,
really huge.
absolutely. Okay, all right. Well, Dr. Kellum, I know this is after hours for you. You probably want to go home and run, jog, or whatever, eat dinner, or be with your family. So I really appreciate you taking the time to.
Thank you so much. It was a pleasure to be with you today, and thanks for thinking of me and letting me know how I can help, and hopefully we can visit sometime soon.